Now that we have defined the emotional response that is anxiety, it's time to explore what happens when it gets out of control. Anxiety is an incredibly common mental health problem, with an estimated 30% of people experiencing some type of anxiety disorder throughout their lifetime. Anxiety disorders are conditions in which one experiences frequent and/or prolonged periods of anxiety, which often worsen with time. In some individuals, these episodes are time-limited and triggered by specific situations or events. They eventually resolve after the trigger is removed, but may recur upon re-exposure. Others may suffer from a constantly elevated level of anxiety, unable to identify any clear environmental factors which improve or worsen this response. It is also possible to demonstrate a combination of these response patterns, with a person having an elevated baseline with periodic exacerbations that may or may not have a clear trigger. Finally, some may even suffer from more than one anxiety disorder at the same time, leading to a complicated and overlapping pattern of symptom development. Regardless of their pattern of onset and duration, the symptoms of anxiety disorders, as well as all mental disorders, can be divided into three categories: cognitive, behavioral, and somatic. Cognitive symptoms develop when there is an interference with mental processing, leading to problems such as an inability to concentrate or racing thoughts. Behavioral symptoms are persistent or repetitive actions which are inappropriate or disruptive, like avoiding all social interaction or restless pacing. Somatic symptoms are physical manifestations of mental health disorders, such as persistent muscle tension or episodes of rapid heart rate. These are just a few of the symptoms which may be experienced by those who suffer from anxiety disorders, with each disorder varying in a specific symptom cluster. Remember that in order to be classified as a disorder, these anxiety symptoms must either cause the individual distress and/or impairment in daily activities, such as job performance, schoolwork, and relationships. Finally, it is important to differentiate between primary and secondary anxiety disorders. If a disorder is found to be caused by a medical problem or a substance use disorder, typical treatments may provide only temporary or partial relief, if at all. In these cases, the primary problem must be addressed in order to fully resolve symptoms and prevent future recurrence. With this basic information in hand, we are ready to explore each type of anxiety disorder in more detail. So remember to stay tuned for more.